is glaucoma? Glaucoma is one of the leading causes of blindness for people over 40 years old. It is a disease that is caused by internal eye pressure buildup, ultimately damaging your optic nerve and creating blindness. Normally, your eye creates a liquid called aqueous humor to maintain your eye pressure. This liquid is consistently drained from an area called the drainage angle. However, if your drainage angle is blocked or damaged, this can cause the pressure in your eye to increase. Fluid builds inside your eye, and this could end up damaging the optic nerve that sends vision signals to your brain. Diagnosis of glaucoma can only be done through a full eye exam from your ophthalmologist or optometrist. Your doctor can find the signs by measuring your eye pressure, imaging your optic nerve, testing your peripheral vision, and analyzing your drainage angles for signs of glaucoma. There are a few risk factors for glaucoma that you should take note of. People with high general eye pressure, known as ocular hypertension, are at the highest risk for glaucoma. Additional risk factors include either far or nearsightedness, past eye injury and steroid medication history, thin corneas and optic nerves, being over the age of 40, and family history. Those with minority heritage, such as being African, Hispanic, or Asian, are also at higher risk. You might also want to know about the two major types of glaucoma, open angle versus closed angle. Open angle is the most common type of glaucoma in the United States. Open angle glaucoma happens when your eye does not drain the proper amount of fluid. Think of this like a clogged sink. The water drains much slower than normal. While you won't feel any symptoms at first, as the disease progresses, you will eventually start to lose peripheral vision, and if untreated, you can even lose your central vision too. Most people cannot feel pressure in their eyes and don't know if their eye pressure is high unless measured by an eye doctor. Closed angle glaucoma, also known as narrow angle or angle closure, is much different. This happens if your iris, the portion of the eye that allows light to enter, is too close to the drainage angle. Your iris could potentially end up blocking the drainage angle, which can either cause a slow rise in pressure that damages the optic nerve, like in the open angle form, or can lead to a rapid increase in eye pressure. Think of this like a piece of paper over a sink drain. This covered top creates an acute attack and is an immediate emergency. Symptoms include severe pain in the eye and forehead, redness of the eye, decreased or blurred vision, seeing halos and rainbows, headache, nausea, and vomiting. In this case, you need to see a doctor right away. Glaucoma damage in general is irreversible, but there are ways doctors can treat you to mitigate and slow the damage. The most common method is with an eye drop medication aimed at reducing eye pressure by slowing aqueous humor creation or increasing the speed of aqueous humor drainage in your eye. These glaucoma medications are typically taken daily and prescribed by your doctor. Some patients might experience mild side effects like stinging, red eye, changes to heartbeat, breathing patterns, and very rarely changes to your eye color. Your doctor will let you know which eye drops are best for you. Sometimes glaucoma may also be treated by laser surgery. Most closed-angle glaucoma is initially treated with an iridotomy to create a tiny hole in your iris, allowing aqueous fluid to flow. Open-angle glaucoma can also be treated through a trabeculoplasty, where your doctor will shine a laser into the drainage angle to make it drain aqueous humor more quickly. Surgeries will usually be done with a local anesthetic. Your doctor will do a physical examination to see if you are fit for this procedure if you are interested. Finally, some patients undergo surgery to treat their glaucoma in an operating room. There are many different types of glaucoma surgeries, and if it is needed, your glaucoma doctor will recommend the best one for you. Once you are taking medications for glaucoma, your ophthalmologist will want to see you regularly. You can expect to visit your ophthalmologist about every 3 to 6 months. However, this can vary depending on your treatment needs. Following up with your doctor regularly is critical to ensure that your glaucoma is under good control and that your vision is not getting worse. In all, glaucoma can seem scary, but with early detection and proper care, Most people avoid severe disabling vision loss. If you are over the age of 40, early signs of eye disease may often begin, so please consult your ophthalmologist on getting a comprehensive eye exam. Here's to seeing life more clearly.